All right, well, the gap to the run-up to the 55th ANC National Conference is narrowing, following a growing support from his home branch. Former Health Minister and ANC NEC member Dr. Zweli Mkhize formally raised his hand to challenge for the position of the ANC president at the party's 55th National Conference. The ANC will elect a new leadership and revisit its policies from 16 December until the 20th of December 2022. Dr. Zweli Mkhize now joins us in studio for an in-depth conversation on his quest to become the next ANC president. Kabazela, thank you very much for joining us, and a warm welcome to our show.
Thank you very much to you and to all the viewers. Thank you for the opportunity.
You're most welcome. Dr. Mkhize, you are now a presidential hopeful for the ANC, but also a presidential hopeful for the country as a whole. The branches have clearly and indeed now spoken. You have been nominated and you've said, yes, indeed, I accept. Why did you accept? Why do you believe you're the right person for this position?
Two reasons. Firstly, I have been asked by the branches to stand, and therefore we know in the ANC it's the right of the branches to decide who they can nominate, and so I've accepted it from that point of view. It's part of the party discipline, and that you don't necessarily have to say you want to, but if the branches ask, then you must make yourself available. Secondly, I think there are four areas that one wants to focus on. The first one has got to do with the rebuilding the ANC, strengthening the ANC as a party, as an organization. That's one issue. Secondly, is to deal with government, to improve the government and ensure that it's able to implement policies and the service delivery. Thirdly, is to deal with the issues of economy. Quite a whole lot of issues here. The level of poverty and unemployment has gone very high. And lastly, is the issue of the geopolitics. We have to focus on that. So I think looking at those particular areas, it's important for us to say we have good policies of the African National Congress. We want to try and get leadership that must focus on implementation. Let's see what can be done. Let's make sure that it gets done and it works.
Dr. Mkhize, your support base mainly in KZN, really where the root really is, if one can put it that way. I have to then ask you, what is your relationship then with the former president, Jacob Zuma? As you know, his popularity is quite up there when we're talking about KZN and when we are talking about ANC. And how has his perceived persecution, sort of affected the ANC in the province? And I would assume you would know, given the fact that you're on the ground now and you've been on the ground and talking to the branches. Have you seen, the changes there when we're talking about that perceived persecution?
Well, the only difference that you have seen is that KwaZulu-Natal went and consulted the branches, sub-regions and zones, and then came together at regions. Then they came up with the name of Zweli Mkhize. And in this case, then they made that pronouncement. But in terms of the support, I've been approached by, branches in all the provinces, and therefore it varies from province to province. So we would not only look at it as a problem, as a proposal that came from KwaZulu-Natal. So it is for me nationwide. It's not only KwaZulu-Natal. Secondly, the issue of the relationship with President Zuma. I think it is well known that ever since I worked in the African National Congress, since the days of military political underground days, I have worked in structures that ultimately reported to President Zuma. When I was in exile, I worked under President Zuma, and also when we came back from exile into South Africa, we worked together. I was the chairperson of the ANC when I was part of that executive. We dealt with issues of rebuilding the ANC together. We dealt with the issues of bringing peace and reconciliation in KwaZulu-Natal. We dealt with the issues of service delivery. We supported President Zuma during the difficult days of the court cases, and we went to Polokwane. We actually supported President Zuma. So we have actually worked very well together. Of late, the concern that has come from most of the branches and the people in KwaZulu-Natal, and this is a case in South Africa as well, has been the treatment that has been meted to him has not been acceptable. The issue is that the incarceration of an 80-year-old man has been a stress to all of us, and it's because of the COVID situation at the time, the risk of him getting to contract that disease, and the fact that at 8 years, there could have been another way of dealing with the fact that if there was a court judgment, there would be a way of dealing with it. The correctional services has got all of those issues. Yeah. So there is a concern, and this, I think, is a cultural issue. Everyone is very sensitive how you deal with the elders, and we all believe that something else could have been done. Yeah. So where we sit, we remain with a good relationship. Of course, we deal with political issues, so we're not always in agreement. Sometimes we differ. Sometimes the differences, we will deal. Most of the time, we deal with them privately and resolve issues, and we've been like that for many years. Sometimes it spills out to the public, but President Zuma has got views which we must respect. Of course, as a disciplined member of the ANC, some of those views have to be dealt with within the structures of the ANC, and all of us subject ourselves to those decisions from the structures of the ANC.
When we were chatting earlier, you spoke about 4 points as to why you've agreed. Indeed, you've put your hand up and availing yourself for the position. And, one might say that, there might be no change when we've got Dr. Mkhize at the helm. This is someone who has been within the ANC structures. This is someone who has been in high positions within the ANC structure. So, what more could he bring to the table that, we didn't see perhaps when he was a premier or when he was a minister? How would you respond to a question like that?
Well, I would say that, if you talk to South Africans, analysts, detractors of the ANC, almost everybody will tell you that they believe that the policies of the African National Congress are good enough to assist in transforming South Africa socio-politically as well as economically. And that means that those policies are important for changing the course for South Africans to have an improved life. And it takes us to the mission of the African National Congress, and that is to liberate all South Africans in particular, with black people in general and Africans in particular, which has not been fulfilled. It's a long journey that we must embark upon. Now, I'm committed to that. And my point is that what we want to do is to bring in an element of the implementation, which is what everyone is complaining about. I believe that I've got the experience and I've got the inclination towards ensuring that there's implementation of those policies. So in other words, I would still say to our people that the ANC is the right organization to vote for because its policies are taking us in the right direction. But because I'm inside the ANC and I have to accept that we must take responsibility for lack of implementation, if somebody asks me, what do you then do if there's no implementation, then I would say, let's then look at changing the leadership. I'm prepared to make my contribution to that implementation based on my own history as having been part of government and as having been part of the leadership of the ANC.
Yeah, and one of the major roles that you have been given within the leadership structures of the party and of course of the country is that of health minister. I mean, while we're talking about the leadership roles that you have played in the country on the back of being one of the leaders of the ANC. And when you were the health minister, of course, this is a role that, particularly in the early stages of COVID-19, I mean, you were really applauded for that particular role. You were really praised for it. And I mean, we'll talk about how it ended. But what are your thoughts on how COVID-19 was treated and how it was, in fact, handled after you left? Obviously, this then means, some introspection and also perhaps even being critical of your own comrades and being critical of your own colleagues. But, would you have done anything differently, had you continued? I mean, there's been a lot of criticism as to how South Africa has handled the pandemic, given the fact that a lot of people didn't even want to vaccinate towards the end. What are your thoughts on ultimately how, it was handled?
Well, where I can comment is how we dealt with it when I was part of the team that dealt with it. And firstly, I must say that I remain ever grateful to be given the opportunity to be part of the team that championed the cause against COVID. I remain very grateful for the support that came largely from the health workers, their commitment and their feeling of love and sacrifice that they did when people walked into the COVID positive ward and knew that they could go home and carry this infection and infect their own family and their family could die. And I believe that South Africans have learned a lot about solidarity, about working together, about supporting each other. And I also believe that we have learned that in difficult times, we could be very resilient and we can face serious challenges, which I think we did. And therefore, I remain ever grateful for having been that opportunities. It has been a very humbling and very educative experience, and I will hold those lessons forever in my life. Once I have left office, I don't wish to get into the details of what has happened. Generally, the spirit of collegiality dictates for us that if you come into office, you will inherit whatever was done by your predecessor in office. If you leave the office, I think you may comment on what you may not have liked, but you need to avoid a sense of ruling from the grave. And so I would say I'm grateful to see that people didn't, we didn't lose more people after that. I'm grateful for the fact that people had accepted to do vaccination. Yes, of course, there were certain changes with time, but because I was no longer in charge of that program, I wouldn't want to cast any aspersions on it. I can only say South Africans have learned a lot, even at the time when a lot was unpredictable, and it will give us a lesson for the future as to how we deal with unpredictable calamities that will come in the future.
Yeah, and there's a crunch of it at the end of the day, is that I am indeed speaking to the former health minister of the country. Dr. Mkhize, why did you resign?
Why did I?
Why did you resign?
Oh, yes, yes. Now, I'm glad you raised that question, but let me tell you, because I resigned at the back of this big investigation into the communications tender, which is referred to as Digital Vibes. But just to take the public again, to remind the public what had happened, this was amongst the matters that were raised by the Auditor General way back in December 2020. I picked up this issue and it was reported to me by the Director General. I then instructed that this must be investigated because the Auditor General suspected that there would have been overcharging. In the process, I then said they must also investigate how it was awarded, and then that it must be done, the investigation must be done by an independent forensic auditor. This process was actually done. Whilst we're in the process of that investigation, I then became aware that the SIU wanted to investigate this matter. I wrote to the SIU and I offered my full cooperation and that of the department, and I indicated to them that we were doing the investigation. The investigation was completed within 5 months, and on the 26th of May, I actually did a public statement which I was explaining now that the results have indicated there were some irregularities in the procurement process, that there were certain staff members that had to be disciplined, and that would start the process of recovering those monies. I did, of course, express that I had seen the outrage, the disappointment, the anger, and I thought it was all justifiable. When the public was unhappy with it and expressed it so, I did accept that, in fact, the public was correct on that. And then a few days after that, some information was revealed that suggested involvement of some members of the family in this whole process, and some staff in the department. I then informed the SIU that I had distanced myself. I have actually pulled myself out of managing the investigation just to create a state distance, and the DG was dealing with it. And all that time I was actually reporting to the president what was being done. Now, as you know now, what has since happened, the issue arose when the SIU raised the report, and they basically had the same findings as we had found in the report. In fact, I think it was the same report that they used to compile their report, that the one that had been done by the Department of Health. But where I differed with the SIU was where they started raising allegations of me being implicated in this report. So I did say to the SIU that their report was flawed, it was devoid of any truth, and it was misleading.
And where exactly are the issues with the SIU report? Perhaps you could break it down for us, where there's actually this problem area. It seems as though the report was pinned on 4 issues, and you raise one of those issues now, the fact that there were benefits accrued to your son. There's the issue of a home renovation, so a benefit accruing to you. Then there's the issue as well of instruction, and then there's one of a cabinet resolution, which I think might be in fact where the biggest issue is for you.
You've got them quite correct. Actually, the issue that they raised, I publicly said, I answered questions to journalists. I said there was no personal benefit. Now, I have been vindicated because that matter was reported and was investigated by the Parliamentary Ethics Committee, which cleared me on that. Then the second issue that was part of that was to do with the fitting of the lights, which was about 7,000, which was done by staff members. And then again, they also dismissed that. So I was cleared on that. The other issue was the fact that the allegation of having instructed the staff, the managers, to award the contract. Now, everyone knows, excuse me, everybody knows that the ministers don't get involved in procurement. And I did say this to the SIU. Now, where we are, the officials that were involved were taken through a disciplinary process. The main witnesses were the SIU. In this regard, neither arose the issue of fraud or anything that suggested or implicated the minister in the process, and they were actually found guilty on issues that related to negligence. So that throws again this the next issue that came from the SIU. Then we asked them, excuse me, we asked them for the copy of the resolution of cabinet. Now, that said that the contract had to be done by GCIS. And in reality, there is no such. The SIU has, on 2 letters to our lawyers, now confessed that they don't have such a resolution. They have never seen it. They've never heard it. So one wonders why and how they actually implicated me in a matter of a report that they don't have. They started by saying that it was classified, but I know for a fact because there's no such a resolution, and we don't know why they would have fabricated such a story. And so the matter now is in court. We have taken to court. We delayed because the SIU has not submitted all the documents that we need to conclude the application in court, but the report of the SIU stands to be set aside. And so from that point of view, as far as I'm concerned, that process is just a matter of time.
We all, it's always great to look in retrospect. When you look in retrospect, do you think you made the right decision at that time, knowing what you know now and what you're explaining at this time, where you have been at pains to explain that you are innocent in all of this? Why then did you fall on your sword? Do you think it was the right decision to do? Could you not have fought this within, your ministry, within the position that you were in? Because it is perceived as someone having been caught in wrongdoing and then falling on their sword. That's essentially what it looked like. I mean, many ministers have been pointed to wrongdoing many times, even of late. But they don't resign. Why did you fall on your sword?
Well, you see, I think we must make specific 2 distinctions.
Yeah.
The investigation I'd initiated, I would say it was justified to investigate. The conclusions of the SIU report, I reject. And I say they are baseless, they are false. And on that basis, I then discussed with the president that I'll have to challenge this in court, and in challenging it, I've also got to cite the president. Now, it was not prudent for me to cite the president when I'm also part of the cabinet. I also didn't want a situation where I use public money to clear what is being a big allegation on corruption. But I also think that having looked at it, it is correct that if there are questions, we must allow the investigation. Now, this whole thing has been under investigation for almost, we're going towards 2 years now, maybe just 18 months. So I've exposed myself to full investigation on this matter, and I think all leaders must accept that they will be held accountable, will be investigated. But looking back at the matter, I think that it has, of course, been in bad taste with South Africans, and I said that their anger, their outrage was justifiable. On the 16th of June, I actually did say, although I am not culpable of any wrongdoing, but I have to apologize, which I did around the 6th or the 9th of June last year. Now, where I sit, I think that I have learnt better, and I would look back and say, it was a busy time. There were too many things happening, but one needs to learn to be more vigilant, and we need to also deal with the issues of, managing the questions of procurement with vigilance, even though I was not involved in the procurement process, but to keep asking questions, I think for me that has been a big lesson. But I would say I want to make sure that such a thing doesn't arise. It's not been my history. Over the years, my record has been about fighting corruption. I've actually got a record as a premier previously. Amongst the reasons why I was voted to be the highest ranking premier had to do with the fact that I not only was focused on service delivery, but it was also on dealing with corruption at the time. So I believe, therefore, that as you look back as well as a Treasurer General, I actually ran a very tight, clean administration. Even though there's a whole issue, for example, around issues of state capture, you have not really had allegations that implicate the ANC Treasurer General at the time. So I do believe in the cause against fighting corruption.
And in fact, while you're reflecting on the issue of state capture, I do believe that we have a question from a viewer, which is a tweet here directed at me. In fact, you can read it while you're there. In fact, it says, Zamarisol said, if someone else gets the position of president, the Zondo reports will be thrown to the dustbin. Please ask Dr. Mkhize about this Zondo report. What is his take? I think you were already touching on that, but just for the sake of our viewer who's obviously watching at this time.
Well, I think you got, views, different views. I wouldn't believe that the Zondo report will be thrown into the dustbin. I don't agree with that. I think that what is important is to take that report and make sure that the law enforcement agents follow it up, and where there's a case, they must investigate without fear or favor, and where there's a culpability, the people must be made to account. And I don't believe that after so much work, you would like to throw it there. But it's got a lot of flaws. It's got a lot of areas which would need to be re-looked at. As the ANC have been looking at it, there are questions which we think that the commission went onto issues that it didn't need to go to. But that's fine. The point is that where there is wrongdoing and criminal action, there must be action. And that would be for the Zondo Commission or any other act of corruption. The ANC has said we are committed to fighting corruption. I accept that. Yeah. The decision to put up a Zondo Commission was not taken after the NASREC. It was taken before. It was taken in 2017. So there is no leader of the ANC who would actually distance himself or herself from the Zondo Commission report and the issue around state capture. We must be on the lookout for state capture from the Zondo Commission, but even in future, this is going to be something that's going to arise. Maybe it's also going on now. We must be always alert. And I think that the lesson we have learned is that South Africans must always be alert, don't take our democracy for granted. And I think the public is correct to be very skeptical and always ask questions, because it's only then we are all able to take accountability and investigate when investigation is needed.
Yeah. Just before we looked at that tweet, we were talking about, the SIU and the fact that you indeed did take them to court, and you mentioned the fact that you did cite the President of the Republic. What's your relationship? And I asked you earlier on about your relationship with the former President Jacob Zuma, but I'm going to ask you about your relationship with the current president, with the incumbent, with President Cyril Ramaphosa, given the fact that, even in court documents you have cited him. You've served, of course, in his cabinet, and you're both now sort of vying for the same position, contesting for the same position, which some might even say is a direct, challenge, and some might even take it further and say it's a direct attack. Let's talk about that relationship and really you going for this position that he holds.
Well, firstly, let me say my relationship with President Ramaphosa remains a comradely, respectful relationship. I met him on the coronation, and of course, we were wielding shields together, and as we were part of that occasion, there's no problem. We greeted each other, and because I'm not in cabinet, we don't talk as often as we did before. Nevertheless, as members and leaders of the African National Congress, we reserve the right to differ. differ on approaches, on how things are done, and I'll quote my views about certain things, and therefore that does not make us enemies, but it does make me very different. And in this case, let me say that there is nothing wrong about contest in the African National Congress. The term of office is 5 years. At the pleasure of the branches and the delegates of the ANC, the leader may be elected for the second term, but there is no law that says that must be the case. And also, we have been in this situation before. In the previous term, I was actually being approached to stand as president at the same time as Dr. Dlamini Zuma and President Ramaphosa, and we talked a little bit about it, and you recall at some point we went to go and have the Last Supper with President Zuma. Now, the message which was given to us at that time by President Zuma was that, well, he was leaving the position, but what was important is for us to know that we cannot tear the ANC apart, and therefore I believe that we are members of the African National Congress. We must accept the discipline of accepting nominations when we are, and we must also accept the discipline of, if we are elected, we serve and serve all the members. If we are not elected, we remain the members of the ANC who are disciplined. And so that's been the situation. We've seen the history like that in the past. The many leaders have contested, and we think that we must teach the members of the ANC lesson that contestation doesn't mean you contest because you are enemies. You contest because the members have a right to choose amongst you who the best leader for them will be. And today it might be one person, tomorrow it might be a different person, but each one of us must accept that each time you get approached and then there's a decision made, you will then rally around behind that one who's ultimately elected.
And speaking of your fellow comrades, we see that Paul Mashatile is indeed eyeing the position of deputy president. Any relation there? I mean, have you had those sort of formal or informal conversations with Paul Mashatile? Because I would assume if things do go your way, he might, in fact, then be serving as a deputy. Talk to us about that particular relationship there.
Well, Comrade Paul Mashatile is a Treasurer General, and he happens to do the same job I did, and so there are reasons why we have to talk about these issues now and again. He's currently acting as Secretary in the Secretary General's office, so we do interact on various matters of the African National Congress. At the end of the day, it's not my selection or his as to whether we will be nominated and how we'll be nominated and how we'll fare in the conference. I think what's important for us to accept the discipline of the party that says whoever gets nominated must serve with those that he's been nominated with. And we always say in the ANC, you don't need to be friends, you need to be prepared to work and as loyal members of the African National Congress. But we come a long way, so we've been part of the leadership for many, many years, and therefore there is no leader in the African National Congress that I can say I'll have a difficulty serving with. I believe that we must give the decision-making power to the branches to decide who they want to elect for what position.
Okay, let's bring in our viewers then. I believe there are some tweets, people already engaging there on Twitter. Someone, it looks like already at the start, there's a credible man. I'm not a member of the ANC, but you can hear when he speaks that he is a leader, surely better than the incumbent. Do you want to make a comment to that?
Well, I cannot say I'm humbled by the supportive comments, and thank you very much.
All right, let's move on to the next. I believe there's more, and I think I've asked this question really, but maybe you can just put it in brief. What changes will he be bringing if elected? That question coming from Mabinzo Z.
Well, my focus is going to be on implementation.
Yeah.
Let me just deal with the thing that makes me stay awake at night. You know, what keeps Zweli Mkhize awake?
Yeah.
The level of unemployment and poverty. I live in a village. I live in a place where, people are desperate, and therefore I believe that we need to do a lot more to, implement programs to fight poverty. So in particular, I think that we must focus on how to expand this economy. That means for me, we need to call a number of sectors together with government and look at what roles we're all going to play together to create jobs and put a target and say, in this area, in this district, in this sector, this is how many jobs we need to get. You will never respond to this issue unless we're actually focused on job creation. Secondly, I believe it's important to stimulate the economy by pushing on infrastructure build program. In this case, again, there's some work that one has done when I was part of government, which I believe needs to be taken forward. That's in relation to taking social infrastructure, the hospitals, the municipal infrastructure, and so on. Now, government doesn't have enough money to do this immediately, but government can have money over the period of 20 years. So if you sit down and have a proper pact with the private sector, they can borrow the money. Government can borrow the money. We can build a lot of issues and stimulate the economy like we did in 2010. And then over 15 years, we spend time repaying, paying back that. Then you need to build entrepreneurship. If you got villages, townships, there's no factory, there's no employment, it's a problem. It's a recipe for disaster. We need to bring them closer. But you also, we've took a decision about creating a state bank. Now leave the state bank part, but let's talk about a bank that will service the underserved. Yeah. There is a reason why people were not part of entrepreneurship in this country. There was a law against it. Now you need to actually go and get government to support small businesses, village enterprises, and put a list of items that government is going to procure only from small businesses. Put a condition for big business to do business with small businesses. Put a bank that must bank the small unbanked and lend them money and so on. And if you deal with issues like that, then you can deal with crime. Yeah. The level of crime is completely unbelievable. And because I live in a village, it's different. If you live in a suburb, if you hear one gun, popping gun there, at night, you'll call and the whole of Johannesburg police will come there to check where the gunshot would have come from. If you're in the village, the whole day and night when, you can hear cars being burnt and so on, somebody will ask, is somebody been killed? No, not yet. No, there's no one killed. Okay, we'll come tomorrow. Yeah. You understand? So the crime has to be dealt with. Drugs have to be dealt with. So these are the issues that one wants to focus on.
You're talking about villages, but one of the issues that are problematic when we're talking about villages is the issue of access to proper medical treatment, to proper medical care. And I've heard you on numerous occasions speaking, very passionately about the issue of, access to medicine, access to healthcare. Would you not better serve those communities as a doctor? Do you sometimes, you say you stay up at night sometimes. Do you sometimes think to yourself, I don't need this politics game, man. Let me just go back to medicine. Or perhaps I'm projecting because I'm always thinking of going back to law.
No, you're quite right. But let me tell you, I'm a medical doctor. I was trained as one, and I'll continue to operate as such. Yeah. My approach and what I have learned as a young doctor, even before I was qualified, is that there's a limit to how far you can treat TB, gastroenteritis or diarrheas and so on. What becomes important is to change the system that creates the socioeconomic conditions of poverty that worsens the disease. Now, since the new government came about in 1994, we've gotten rid of diarrhea wards in many hospitals. We've gotten rid of kwashiorkor wards because of the policies that we've dealt with. I would say my concern has always been about the health of the people. It does not change it. I didn't come here for politics. I came because I wanted to make an impact on the lives of the people. And as a member of the African National Congress, the mission of liberating South Africans, bringing equality and creating a non-national democratic society where the gap between the haves and the have-not has been reduced, the gap between those who are advantaged and those who are under apartheid is actually eliminated. If we focus on that, whether you've got challenges today or tomorrow, that job is not done. And I think the African National Congress remains relevant because of its policies. We just need to make sure that if there is no implementation, then bring in people who can focus on implementation.
All right,
and get things to
Unfortunately, we're out of time. Dr. Zweli Mkhize, thanks very much for coming to sit with us here on SABC News. We certainly do appreciate your time, and no doubt we'll be nagging you for more sit-down conversations. That's Dr. Zweli Mkhize, ANC NEC member and presidential candidate. Thanks very much for being with us here today on SA Today.